pledge allegiance to the flag of the United States of America
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. We have any public comment? Seeing no public, no comment. Approval of the consent agenda. Has everybody had a chance to read the minutes?
I move we approve the consent agenda.
Have been moved and seconded to approve the consent agenda as presented. All in favor? Aye. Okay. Moving right along, the January 2018 LHD financial report. Cheryl.
Okay, listen carefully, here it goes. Okay, January was a much busier month than December or November. We were much busier in the hospital. We weren't quite as busy with the swing beds. It was a very good month. Also a very good month with ancillaries, strong. Where it was crazy good was the number of rehab patients at 884. I think that was a record month. That was crazy. So that was good. This led to a record-breaking month of revenue that was just shy of $3.3 million. Okay, and then our collections on AR is right here. So we had a very good month. The collections were just over $2 million, which is above average, it comes up in January. It's not surprising because November and December are usually pretty bad. It's pretty good. I think it could have been a little bit better. It's above average. Average 1.8 now, not so bad. Days in AR stayed at 84. Last month I told you about some bad debt issues we had, that we had several $100,000 that we had not written off, sent to collections. I said it was done, and it turns out it wasn't. Didn't get done. Part of the struggle is there's no visibility during the month into what's going on in AR. You have to wait till it closes and it gets pushed to the GL to actually see what happened, unfortunately. So it's kind of hard to track, but so I've been assured that it's done now. The bad debt was accrued, it's just still in our AR, so it's affecting our days in AR. So at least we'll see a huge hit on that. Let's see, what else I can tell you is that Lisa is focusing on the old debt in our AR. She's trying to have her staff focus on it. She spent a lot of time with CPSI. They're coming out on March 18th to spend some time training and kind of trying to optimize some of our processes. But after conversations with them, I am pretty well convinced that if we want the tools that we really need to do a good job on our days in AR, we're going to have to buy more of their software. So they've been trying to sell it to us for a few years, and we might have to break down and buy some of it. So here's our days cash on hand. It is up to 113, which is a good thing. What's impacting days cash? Right now, I only have about $500,000 available to borrow on the bond, or for the loan on the clinic. So I did a big borrow in January, and there's a big bill outstanding at the end of January that had just come in. So really, there's not a lot I could do to improve that days right there. And I think, just another point about our days in AR, when I was looking at it earlier, if we could get our days in our AR down from 84 to 60, that would bring us in about $1.5 million, and our days cash would be 135. So, I think you guys already kind of knew that, but that's the numbers. Okay, for the month of January, we had a very good month, awfully close to budget for revenue, awfully close to budget for expenses. We had a net gain of $100,000. Our non-operating income was good this month because the Collins McDonald grant money was deposited that month, so that was good. Year to date, we are $1.5 million behind what we budgeted, but we are also $2.8 million ahead of where we were last year at this time. for our total expenses, we're also well under budget, under $2.1 million and $855,000 ahead of expenses. So those were good numbers. Our revenue is much higher, is growing much faster than expenses. That's a good thing. Our net right now, year to date, after 7 months, is $945,000, which is $866,000 ahead of budget. Balance sheet had quite a lot of changes this month. In January, booking of a couple of big bills to Detroit brings our fixed assets up. We also purchased the DEXA scanner and a new car and that sterilizing robot, so we had a big month adding to assets. And then the debt, of course, is going up at the same time the assets are. And our current AP went up quite a bit with an Adroit bill in there, so no surprises with that. So any questions for January, late month? Okay. The next thing is you did receive the budget assumptions for our 2019 budgeting. And of course, this is just a baseline for us to start actually creating budget, trying to do estimated budget numbers based on some of the assumptions, on these assumptions. Doesn't mean you're agreeing to any of it, it just means this is what we're gonna base our work on. And I do need your approval for that.
I gave I put in your packet from our strategic planning this afternoon, a verbal as well as the part about the different FTEs.
FTE list.
We spent more time on the FTEs than the others, but it still mostly describes the stuff we talked about in terms of the staff.
We still really have plenty of time to make some adjustments and changes based on your strategic planning and what we know between now and when we actually draft the budget to look at. Any input is welcome.
You need a motion?
Yeah, get a chance to take a look at it. Need a motion?
I move we accept the strategic planning budget assumptions that we were given with the adjustments that we discussed in our planning session.
Second that. Okay, we moved and seconded to accept the budget assumptions for fiscal year 2018-19 with our discussion in the session earlier today. All those in favor?
Aye.
Opposed? Hearing none, passes unanimously.
I have a question. We talked about the budget calendar. Do we have dates for budget meetings?
Yes.
I must
Yeah.
have missed that.
We could send you another.
Yeah.
Well, I got it right here.
Okay. I was gonna say we could send.
No, I think
She
we're,
missed that meeting like that and maybe found it out.
okay. And I
That's,
think
I think,
we're
what happened.
set now.
Mhm.
Everyone, it was
Yes.
tentative until we can confirm that all the budget numbers could make it. And I think we're good on that, so we're set.
Okay. Goose Lake Medical Services, Gomez.
All right, so we'll start with Lakeview Gardens. They had patient counts of just about 22 and a half. It's been really steady the last several months. So 696 patient days. Revenue has also been super steady the last several months. This month was 206,000. And our P&L, this is our January results, this is our year-to-date, the prior year. A couple of things to change this month. We did have still a lot of contract labor. Hopefully that's going to start slowing down after this, based on decisions and choices we made. And we did start to charge rent to Lakeview Gardens finally, based on the 2 units they've occupied. And next month it'll go up in the is occupied, and you'll see that reflected in, or you did, it was also reflected, I forgot to point that out, but we've started depreciating the buildings also. So our depreciation is pretty far under what we planned, because we thought we would occupy and start depreciating those buildings 6 months ago, so that's why that number's.
When we move people to assisted living, are we going to have a change in what the state charges in the tax? Is that?
I don't think so. I don't think we've got the numbers to make that happen. I don't think we're going to be able to do it. But we'll always keep looking at it.
Yeah,
You know?
absolutely.
Yeah. Okay. Year to date, we have lost 456,000. We really had our latest estimates to you were that we would lose about $1 million. So we're just, after 7 months, we're a little bit less than that, so that's good. All right. Next is Goose Lake Medical Services. Again, so you know, I have to tell you the good news. I'm sorry, this is bad. Lost $27,000. I see that. Whoops. Whoops. Shut up. Just don't say anything. Okay. We lost $27,000. It's not good. We've lost $188,000 this year. Roseanne has been doing walk-in patients, and last week she saw 10, and this week she saw 12, which is really, I mean, I know that doesn't sound like a lot, but we were able to upgrade their internet service down there because it was so slow that the doctors could hardly even see 6 or 8 patients a day because the system works so slowly. So we actually managed to fix that, and now it's working the way it should. And Roseanne is really starting to build her walk-in practice every Wednesday, which is good. I really feel confident that Foster is going to build a practice, but the very best news we have is that we did get a confirmation today, and you probably already talked about it, that the license transfer was approved. And there's a couple of formalities that are left, which is basically filling out paperwork, but we don't need any more approvals. And we are totally expecting to go back and rebuild at the higher rate for the whole year. So I would think, you know, that's going to add 50 to 75% to those bills, more than double. So that's something to be hopeful about. Okay. And the medical supply had a very good month. I feel like we finally have kind of gotten smoothed out with staff, and people are getting trained. They're starting to expand into MODOC some more with the oxygen concentrators, and all things considered, I think that's a really good number, because, you know, we do want to make money, but that's good. If we do that every month, that'd be awesome. That's all I got.
Any questions? Comments? Okay.
We'll watch the next month. I'm not gonna make any promises. Do you want me to?
Patty, you're
No, I
on.
would just say that our plan,
Okay.
we have one last thing to add to that.
What I'm gonna try to do is to start making a consolidated financial statement, so it is similar to what the auditors show us. I think because there's a lot of challenges to getting our month closed. We have to wait for the billing office to get done. It usually takes until the 10th. We have to wait for some of our big bills, like our pharmacy bill, to come in. Sometimes they don't send us our bill. We get nothing until like the 25th of the month. We could accrue it, but I mean, it ranges from 60 to 110,000. And I mean, I just can't really even vaguely accurately guess what it's gonna be. So I don't really like to do that. It's too big of a number. And so it's really hard to close, you know, much before the 22nd. But I think that starting next month, we would really like to show you, you know, what I would do is go back and show you what the consolidated numbers were for January. So we'll probably lag a month because we'll need some time to, it takes us this long just to close. You've got to eliminate the intercompanies, and it might take us a little while to get good at all of those things, but I think it would help us as far as being comparable to what we see on our audit. Because right now, to me, it just seems like it's really hard to correlate.
Do you need the board meeting a week later each month?
Well, the first is kind of a killer. The fifth would be way better, but, no, I think we're okay right now. I mean, we really have gotten into a pretty good rhythm. With everyone settled on what they're doing and how they're doing it. So I'm just not sure if we can get the consolidation done, so at least for a while, it'll be a little bit behind, but I think behind is better than not at all. So, because there's just such a vast difference between the individual and what we see from the CPAs.
And we want to make sure that you are seeing the consolidation of the different businesses, because that helps give you I think, a more comprehensive understanding. You look at all of these, sometimes it's difficult to put the whole thing together. And we talked a little bit more earlier about silos. How do we go about trying to sometimes break down those silos? And if we can create a better picture, I think we still show you each individual business, but I think that helps give you a better picture, and the public a better picture of what.
You will show individual pictures?
We're not going to change, not to do that. This kind of detail,
Okay,
well, we have plenty of
Just
detail,
want to add to it.
okay.
and that is to give you.
But you, okay. I like to see what's happening with
Oh, yeah.
with long-term care and with
Yeah.
Goose Lake and with durable.
But when they make all those changes and they eliminate the do-froms and the do-tos, I mean, it's making these million-dollar changes. And I don't know, I just feel like I have to really sit down and think about how did we get from A to B, and I want it to be more transparent for all of us.
We were talking about kind of a consolidated summary.
Yes, yes.
Because that's frankly what you saw the auditors presenting.
Yeah.
And it gives a view of it. The more ways that you see it helps, I think, in relating to the different organizations, because we are fairly complex. And if we can help create that unity, that might help. Might not, we'll see.
Try it on a show.
Okay.
And if you want, you could rejoin the finance committee at meetings on.
It's really on. I do read it though. Cheryl still saying, well, you said it there.
I knew you were the adventurous, not you.
Anything else? Then we'll move on to Fast Health Reach. Patty?
Several days in August, our website vendor had a breach of information, and they notified us in late fall. I think y'all were told about that. We've gotten an update since then, so I just want to pass that information on, because we're close to notifying people who were affected. We didn't know at the time what was affected, if anything affected us. So that's all been sussed out. This breach was done by people in Eastern Europe. Our vendor was notified by law enforcement, so Fast Health didn't catch that information. They were told by law enforcement. They have found that it was people who have submitted applications through our website. So the information that was, they would only tell me it could have been potentially viewed. That's as close as they would go. And it was names, addresses, and unfortunately social security numbers. So what Fast Health is doing is they should be notifying the affected people very soon. If not this week, then next week. We sent in as much of an update on addresses as we could provide, and we did that last week. They'll be sending out letters notifying people. There were probably 950 people that could have been affected through our websites. We had a contract with them from 2010 till 2013, and then we picked it back up again 2015 until now. We currently have one. So that's quite a few people. And it was just over that few days, but that can include everybody. So Fast Health is going to do the notifications. When there's a breach, there are certain agencies that you have to notify. Fortunately, there was no protected health information, so there's no kind of a HIPAA breach. It's identity kind of information. They are going to provide a year of credit monitoring and identity, theft restoration kind of consultation services. And that's about it. That's about all that they can do. And it's unfortunate, but that's kind of our world anymore.
So anybody affected should be changing their passwords.
Well, it was information that was submitted through the website. So if there was a website, is there a website or a password required to submit through the job application?
And shortly after I came on board, I had social security numbers taken off applications. I don't know why.
But they
So
still
that
have
had that
a full
re-
one.
Yeah, but they have
You did.
the ones before that, but they're no longer, the social hasn't been on the application for well over a year. That was removed, so.
There were a few driver's license numbers, there were a few date of births, which is, we haven't done that for, I don't know how that even got there. So, it's unfortunate, but I think that they're doing what they can. We just have to be ready to answer questions.
Okay, well, thank you.
Okay.
They call me, I'll let you know.
That position you wanted, John, it's filled, I'm sorry.
Okay, any comments? Okay, the nursing report. Teresa, you're up.
Wow, you're just zipping along, you guys.
You betcha.
You're tired? I don't have a lot. There hasn't been a lot of change. We've been busy. I have a couple things about outside of nursing. The sleep lab will be undergoing an on-site inspection, which is the second part of our full certification that's required by Medicare. So that's done by AASM, the American Society of Sleep Medicine. They will be on site mid-April to perform a day of inspection. And hopefully once that's completed, we will have all of our certification completed and it'll be good for 5 years. So that'll be good. It's been a big project. And then the other thing, which is kind of interest, I think, is that our CPR coordinator has, our program is continuing to expand outside into the community, and we've now been approached by several of the government agencies, Forest Service, Fish and Wildlife, to do both their permanent and seasonal employees. So we're looking at how much of that we can handle. And so that is going to actually involve probably well over 100 people, so could be 200. So those two things are going on. I don't think I have anything else unless you have questions.
Disaster people involved in that?
We do allow anybody who works as a volunteer to have free CPR. So we don't charge any volunteer agencies or volunteer people. So we've already been meeting.
Yeah, but they don't help you train.
No, they aren't part of our, we thought some of them might join up and become CPR instructors, but so far that hasn't happened. So all of the instructors right now are still in-house people, both on long-term care, Lakeview Gardens, and hospital. So that's all.
Any other comments? Cooperative bunch tonight. Next item, medical staff privileging. I don't see Dr. Graham here.
I think Dr. Graham was working in the emergency room or not available, but in his stead, we have 2 applications for reappointment. One is for Dr. Scott Stevens, who is an ophthalmologist with Dr. Fay, and the other is Dr. Womack, who is a radiologist, and the medical staff has reviewed these applications and have recommended to you that you approve them.
So moved that we accept the recommendation.
I'll second that.
Discussions? Been moved and seconded to approve the medical staff resolution as presented. All those in favor?
Aye.
Passes unanimously. Okay. Good part, employee recognition.
One of the things that's been happening in the hospital that has, we spent a lot of time talking about the Climate Community College nursing program. And you know we worked a lot on coming up with our agreement. Well, one of the big pushes has been to have the students actually do some of their rotation here in Lincoln. And we were able to get, I believe, all 6 of them, is that right, or 7?
Well, we have 4 seniors and two juniors.
Okay, so we have 6 students that have been doing some of their clinical work here. That's a really big, great thing for us. It's taken a great deal of coordination, and with Teresa being on she's the chairperson of the committee to look at how students are working and how the program is working. So it has a lot of input. But it's taken a lot of coordination for the students themselves to make sure that they're, we actually have someone who functions like a faculty member, reviews what they do, reviews how well they're doing, and has been evaluating them. Our employee of the month is Carly Alves, who's been doing that. It's a lot of work, and it certainly has brought to light, not only for her, that relationship, but has brought us up a whole bunch of things that we didn't know and will help us do a better job as we deal with the students, but also finding other opportunities for us to work on. So, Carly Alves.
Good.
Can I continue? Pardon? Would you like me to?
Yeah, now you're on again, CEO report.
Inasmuch as we have spent most of the afternoon, I'm probably talked out and you're probably tired of me talking. So I only have a couple things that I think that you wanted to know about. First, Larry Coulter, our assistant administrator for the assisted living and the long-term care, took his test for the National Boards for Long-Term Care and he passed. So he's now certified both in the state as well as nationally as a long-term care administrator and is the administrator for the assisted living. Now, the reason he's still considered as an assisted administrator for those is the state has not yet determined if he has enough bandwidth to be able to do both. And so I still function as the administrator of the long-term care, he's my assistant, and the administrator of the assisted living. Once we open up the assisted living, and it looks like it'll be within the month, then 6 months after that's been opened, they'll come back and do a re-inspection. If we don't have any problems, they've assured us, they being the state has assured us, that we will be able to have Larry as the administrator. So that's how that process will work. In terms of our construction in the clinic, it has been moving along fairly well. We talked a little bit about some of the issues, but we are planning, if all goes as well as we think it is, to be able to occupy and move in by mid-April. So in order to get there, there are several steps we've had to do. The state gave us approval, I think it was a week ago, to occupy the west wing for, we have temporary approval for occupancy of the west wing for the clinic. So that was a big step in order to do that. We didn't have to get approval for the infusion room or for the DEXA scanner, but that was part of that whole process. Now we are able to move the clinic, the specialty clinic, into that location. They'll begin moving that. We have power and computer connections. They're working on the schedules for that. So that may be within a week or two. But we'll move everybody there. And we'll then have the public coming in the old long-term care entrance on the north side. That'll be the main entrance for the specialty clinic. That'll free up the Detroit to start work on remodeling in that space. That should, they believe it may cut down the timeline by a couple of months. Depends on how it goes. Once we have the building, the new expansion component pretty well completed, we can get a certificate of occupancy. And they're anticipating that to be the end of March, so in about 4 weeks. But then we have to get approval from the state to move the clinic in. So we have to make sure that they're going to come down and look at where the furniture is on it, to make sure that the space around the exam tables and everything meets their requirements. And we anticipate, we're trying to schedule it, that's what I'm saying. We think we'll be able to move all of the Rural Health Clinic, Lake Health Clinic, into the new space by mid-April. Maybe quicker, depends on the state, depends on these inspections. We anticipate moving all of the furnishings over the weekend, so that Friday we would close seeing patients, move everything, and all goes well. Monday, be able to see patients in the new location. So we're working on coordinating the schedule right now, make sure we got staff to help with the move, make sure that the construction's all ready. And of course, we'll have to build a tunnel so that patients can walk into that new space, because they're going to remodel it. Got the old clinic as it is now. Okay, so that's the steps that we'll be going through. Our vendor was up in North Lake, in Christmas Valley at North Lake Medical Group, or Medical Clinic, to look at space. They've asked us if we'd be interested in renting for mental health, and they have some rooms, so we're looking at what it would take. I have the plans. We're currently housed in the county building that's squeezed in between the Veterans Services and the police and public health, and we have not a very workable space. So we are, I anticipate that the North Lake Medical Group board will come down and talk with us in the next week or two. So we talked about with that. We thought there might be some space. I looked at it about a year ago, and it didn't really work. Now they've had some changes. So if we can make that work, that'd be a good way of us all sharing space. And we're working on that. I did put an article on your, or Ken did, that you might want to take a look at if you get a chance. Yes. Okay. And that's having to do with ambulance services in rural area. Do you have any questions of me other than what we've talked about all afternoon? If not, that concludes my comments.
Okay. Let's take a 10-minute break and then come back in executive session under ORS 660. Dr. P, Dr. Day personnel, Dr. C medical, and Dr.